The gentleman from North Carolina, Mr. Meadows, and a member opposed. Each will control 5 minutes. The chair recognizes the gentleman from North Carolina.
I thank the Speaker, and before I get into my amendment, I want to thank the chairman of the subcommittee for not only, and the entire staff, but for not only a very thoughtful bill that really requires very few amendments, but really working with members of all different ideological stripes in our conference, and I look forward to being able to support this when it comes up for a vote tomorrow. My amendment prohibits funds from being used by the Office of Personnel Management, better known as OPM, to administer the Obamacare's multi-state program. Obamacare required OPM to contract with health insurers to make multi-state plans available to consumers in all the states in D.C. by 2017. Now, there's only one problem with that. There's only one state participating. And yet, here we continue to fund it. The multi-state plan program has failed to meet its statutory requirements, and it's failed to generate competition in the healthcare marketplace, and it's failed to lower health insurance premiums. According to OPM, the government has spent $53 million on administrative costs for this failed program. The evidence is clear. This program doesn't work, and it's a waste of taxpayer dollars. In fact, the Congressional Budget Office and the Joint Committee on Taxation said eliminating funding for this plan will not affect the levels of competitions or premiums in the insurance markets, nor would it affect any Obamacare subsidy. So my amendment does not take funds away from OPM. It leaves more money for OPM to continue on with other mission-critical programs without having to waste the time and resources on a poorly functioning multi-state plan program. Now, I've got letters from the OPM, Office of Personnel Management, who administers the plan supporting the elimination of this program. I also have a letter from the National Active and Retired Federal Employees Association, better known as NARF, who represent the interest of more than 5 million federal employees and retirees and their survivors supporting the elimination of this program. So finally, this program is widely viewed by analysts on both the left and the right as either a de facto public auction or a plausible foundation for a future public auction option. The House should vote overwhelmingly to do away with this, and I urge my colleagues, both Democrats and Republicans, to do so.